Hi, everyone. I am going to present this paper, which is the impact, examining the impact of early childbearing on labor outcomes in Brazil. I wrote this paper with my co-authors that are named here. And the idea is that, according to the World Health Organization, we more than 20 million girls from age 15 to 19, and about 2 million under 15 become pregnant every year. And this happens most in low and middle income countries. The average global birth rate among the age of 15, 19 is 49 per 1,000 girls, and the highest rates we see in sub-Saharan Africa and Latin America. Just to have an idea, in Latin America and Caribbean, the average is 66 births per 1,000 girls. In Brazil, we have a very high rate, 68. In Uganda, 111. In the US, around 22. So the main objective of this paper is to measure the impact of early childbearing on women's labor outcome, market outcome, and these market outcomes, we mean participation in the labor market, participation in formal jobs, and earnings. There are difficulties in the interpretation of the impact of childbearing on mothers' work, due mainly to endogeneity of this decision. A woman's decision on the number of children she has is a choice variable, which is influenced by factors such as her motivation and her own assessment of her productivity and labor market returns. So these factors will also affect labor force participation. Estimation of this effect is complicated by the high prevalence also among the lower end of socioeconomic distribution. So many poor girls are the ones that get pregnant early in life. Recent literature have proposed relevant instruments of becoming a teen mother via infertility, such as miscarriage and age of menarche. These are the papers that started using these instrumental variables. And in this paper, we are using the model here. Y is a labor outcome. X is a vector of control variables. C is the childbearing variable. And this variable is 1 if a woman from 20 to 49 years old had a baby before the age 20, and is 0 otherwise. That's the childbearing variable. The instrumental variables, as I said, will be menarche and miscarriage. Menarche reflects the woman's age of the first menstruation, while miscarriage is equal to 1 if a woman had a spontaneous abortion and 0 otherwise. So the equation is the childbearing variable as a function of menarche, miscarriage, and some other variables. Estimating this variable, we find the C hat, the estimates of childbearing that is going to be used in equation 1, and we estimate the delta parameter that is our parameter of relevance. So to do that, we are using a Brazilian National Health Survey. This survey has around 80,000 households, and they question every person about the social and economic level, about health status, about childbearing, pregnancy, and many other information that are very useful in this analysis. Here we see the distribution of the women's from 20 to 49 age of menarche. So we see that ranges from 8 to 23, but really small numbers here. So we can say goes from 9 to 18 years old. And here we have the percentage of women that had baby before the age 20, which is childbearing equals 0, and had miscarriage, and the percentage of women having baby before age 20, childbearing equals 1, and 0 is childbearing, having baby with more than 20 years old. And miscarriage is a lot higher when a woman had baby earlier in life. So here we have the percentage of women have had baby before 20, so childbearing equals 1. And in the X, we have age of menarche. So the highest the age of menarche, the smallest the percentage of childbearing. So it's the negative effect here, and miscarriage we have a positive effect in childbearing. So the expected results for labor force participation is not clear, because could be negative if the reservation wage is higher and the time spent working is be foregone with her child. That requires intensive baby care activities that could prevent women from entering the labor force. And on the other hand, could be positive because most girls and teenagers are from low-income families, and due to lack of income, they increase the extra expense due with small children, and they actually enter in the labor force. Entrance into the labor force, however, does not mean a high-quality job or high-quality employment. Usually, due to lack of human capital, low-paid jobs are prevalent. Working or taking care of a baby will decrease schooling, and less human capital formation will result in less labor opportunities, less formal jobs, and lower wage rates. The results show all that. So the labor force participation, which is work or not, is estimated using a bivariate probate model, because we have an endogenous right-hand side variable that is binary, childbearing, and the dependent variable that is working or not as also as binary variable. And in this model, we find that childbearing is positive. So if a girl had baby early in life, she will increase labor force participation. We also estimate an IV model, and we got similar coefficients, although this was not significant. So these are the control variables used, and remember we are using instrumental variables for childbearing, menarche, and miscarriage. Also, as a control, we use age, race, number of kids, drink and smoke during adolescence, abortion, religious, weight, height, chronic disease, education, household infrastructure, family income, and location for all the states in Brazil. Here we estimate for formal jobs, so it decreases the probability of being informal jobs if you have a child early in life, and of course it will increase the informal jobs, so the low skill jobs. And finally, the log wage hours, so the earnings equations, we also find a significant reduction in the log wages for those that had baby early in life. And then we look at heterogeneous effect, how much this childbearing affects blacks, mulattoes, and low-income groups, and we find an even stronger effect for black and mulatto, the poor and the poorest regions of Brazil. Increase the probability to work and decreasing earnings significantly more than what we had before. Also, mothers at highest income group and live in richest region decrease the probability to work in formal jobs significantly more. So finally, we have some policy recommendations. Of course, we need to overcome cultural barriers. In this case, it's very important. So access to and utilization of contraceptive methods for adolescents, sexual education in families, school environments, gender equality, social and cultural understanding of adolescent mothers on several accounts. Education, so during pregnancy, maintain girls and adolescents in schools and counseling units in schools. Post-birth period, provide daycare services for the baby and counseling for the mother. And labor participation, it's known that adolescent mothers typically end up in low-quality jobs or informal jobs without any medical care and other social welfare-related benefits. And in this case, social programs are very important. Thank you very much. And this research was carried out by the PEP, Partnership for Economic Policy Organization.